The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, I'm Tony Urbanek, and we're here to talk about TMD Demystified today. Welcome to all viewers, and I'm looking forward to talking about this topic today with you because it really addresses the major point of the demystification of TMD. I'm going to compare later on the treatment of TMD with various modalities versus decreasing inflammation within the temporomandibular joint. If you followed any of the podcasts prior, you will obviously know that if you can decrease inflammation within the temporomandibular joint, all the known symptoms associated with TMD, which are frequent or recurring headache, earache, jaw pain, neck pain, tinnitus, subjective hearing problems, vertigo, shoulder and upper shoulder and arm pain, arm, hand, finger tingling and numbness, and locking, closed locking of the mandible. But in September of 2021, it is extremely common for those symptoms to be misdiagnosed, misdirected, mistreated, thinking that those symptoms are coming from somewhere else or have some other primary diagnosis other than TMD. So I wanted to dissect this a little bit today from a very simplified point of view, and hopefully, again, I can present it cogently, and you can follow the process here of my thinking and presentation. But let's start out with definition of science. Science is the study of cause and effect. And we're going to bring this down to specifics of, the scientific address of TMD. But first, let's just define a few terms and talk about where we're going to be discussing this. Science is actually the study of cause and effect. Now, you can take any issue in physics, in biology, neuroanatomy, and look at it from the point of view of cause and effect. Let's just take something pretty simple, came to my mind. If you see the moon rise at one horizon, go across the sky and set at a different horizon, before we knew about the sun and the planets that surround the sun, it was mystical to some people why that would be. But when you understand the cause of that effect, which is the moon rising at one surface and setting at another surface, you fully understand what it is. You understand the cause, in this case, that the moon circles around our planet. Well, so if the same thing applies to any part of science, you're looking for cause and effect. Now, within the issue of TMD, what's gone on and what's happened here is that the symptoms, which is the effect of TMD, are well known. But the treatment is a treatment on the effects, not the cause. So you end up with a lot of things going on that, number one, are not effective, and it's backward thinking. If you want to solve a problem in science and understand it and come up with a solution, you need to understand what the cause is. If you understand what the cause is, you are much closer to coming up with a solution, because if you can delimit, ameliorate, stop the cause, then you will not get the effect. I hope that's logical. I hope that makes sense to everyone out there. But what we see in medicine, both dentistry and the science of general medicine itself nowadays, regarding this particular group of symptoms that we classify as TMD, more often than not, in fact, by far more often than not, the attempt is made to fix it by ameliorating the effect, not the cause. It is really simple. The concept is simple. And then if you know what the cause is, in this case, inflammation, and can figure out a way to decrease inflammation within the temporomandibular joint, then the effects go away. I can't attempt to make it more simple. So what we see in 2021 is a group of treatments, and again, I am not trying to criticize anyone, but I am being direct, and I am being forthright, honest of what I see. Now, which can take me back to how I got here in the first place, because I didn't like what I saw 10 years ago as a surgeon in the effects of surgery on the symptoms of TMD. But there are a lot of other things going on besides surgery, surgery being primary on my mind and primary in my experience. But you end up with things like Botox for the treatment of muscle trismus of the face and the neck or the upper shoulder, or wherever it's used, to paralyze the muscles, which does a good job of paralyzing the muscles, but it does not treat the cause. And therefore, other muscles that haven't been paralyzed will and can be affected. And of course, any of the other symptoms like tinnitus or subjective hearing problems will continue on. And the patient usually does not know that those symptoms have anything to do with inflammation within this joint, within the temporomandibular joint. Botox is on my mind because I see a long litany of people that it seems to be the common thing now. The dentists are getting into it, the neurologists are getting into it, the physical therapists are getting into. Anyone with a syringe and a needle feels that they can and should treat those symptoms of temporomandibular joint with Botox. There are other treatment modalities that are being used that I'm familiar with, because I see these patients all the time march into my office with a litany of one or more of these treatments, which can and do include dry needling. That's a treatment that is proposed by primarily physical therapists. And of course, physical therapy, chiropractic, massage therapy, of course, surgery, which I'm very familiar with those modalities, muscle relaxants, myriad of different kinds of drugs, psychiatric and neuroleptic drugs I've seen used frequently for symptoms. Sometimes when it's under the case of a misdiagnosis, and sometimes when it's under the case of a proper diagnosis, is TMD. But the unfortunate thing is, because I have seen so many patients, thousands with TMD, I get exposed to all the stories of patients who have been addicted to narcotics, who have had long history of drug therapy for one reason or another, drug therapy for migraine headaches when it's not a migraine headache, it is a TMD headache caused by inflammation within the temporomandibular joint. No doubt that inflammation within the temporomandibular joint causes headaches. And the neurologist and the hundreds of studies associated with migraines, not one of them will claim that they know what causes migraine. There are a lot of theories about it. That's great. Lots of theories, but not one study or one practitioner will tell you that they know with certainty what causes migraines. But we know with certainty that inflammation within the temporomandibular joint will cause headaches to go away, bad headaches, because when you decrease the inflammation in the joint, the headaches decrease. And that has been shown by many studies, including the study that we've just completed based on my 3,000 cases in an independent study through Middle Tennessee State University. So I want to go forward from this point, not only in this edition of the podcast, but all editions to come, from the point of view that we are dealing, and we want to deal with science. Science is the gold standard. The scientific method is the gold standard. And science is nothing more than the study of cause and effect. And so we can know the effects. It is important for us to know the effects of TMD because those are called symptoms. An effect of TMD, which is inflammatory changes within the joint, temporomandibular joint, will directly cause all of those symptoms. And I've discussed it in detail in prior episodes of why that is. How can inflammation within the temporomandibular joint itself create directly all of those different symptoms, which is confusing to the patients and confusing to almost all doctors, especially physicians, and almost all of the dentists, but physicians for sure, because they have actually, believe it or not, a limited scope on anything having to do with the temporomandibular joint. It doesn't even come in to their wheelhouse. They don't even think about the temporomandibular joint because to them, the temporomandibular joint is part of dentistry. And how do I know that? Because I have heard hundreds of times when patients come in and they say, I have seen my PCP and I believe, or he believes, or I believe, or I have been told that I have TMD. The next word out of the physician's mouth is, well, you need to go see your dentist. So physicians across the board, 100% believe, been told, understand that anything having to do with the temporomandibular joint is the purview of the dentist. I don't know whether you want to hear that or not, whether that's good news or bad news to you, but that is how physicians think about it. I have something on my mind I want to share with you because my physician colleagues, just across the board, they know nothing about dentistry. Although in most states, a medical license will give the medical doctor, they have total ability to treat. And in most states, a medical doctor has the total license to, take out lesions within the mouth, actually take out teeth if they want to. But that's not what I was thinking about. It makes me smile. When I was at Vanderbilt in my medical school training, because I had already been through dental school, and I was an oral and maxillofacial surgeon, they asked me to give my class instruction in dentistry. And it wasn't a course. They allowed me, because it's the course structure is very structured and very busy, as you might imagine. But I said, well, how much time do I have to talk to my classmates and instruct them on dentistry? And they gave me an hour. I didn't ask for it. I was told that they wanted me to speak about dentistry to my 100 classmates. And I had an hour to tell them everything I knew and everything they needed to know about dentistry. I actually don't know how that lecture, I don't even remember what I remember. I spent a long time thinking about what the heck can I say that's meaningful and will be helpful to these newly minted doctors that might help them in their practices. But I can tell you it wasn't much. So the point being is that our medical colleagues don't know anything about temporomandibular joint, except that if they think it has something to do with the TMJ, they're not going to send it to their ENT colleagues, and they're not going to send it to the neurologist. They're going to send it to a dentist, and hopefully to someone who actually has a proper answer, other than a night guard or do nothing, or send them elsewhere that they get some kind of treatment that is ineffective, and certainly something that is certainly not anything that will be harmful. And I don't want to get too deep into the things that I've seen that have been harmful to patients, but of course, I already mentioned narcotics, which I see fairly frequently for nondescript constant pain, and the of course surgery that is ineffective, and I've actually seen 2 cases of documented TMD that had been treated neurosurgically and had missed the diagnosis of TMD, causing constant chronic headaches. And if you want to read up about that, you can read on Chiari malformation. Read up on Chiari malformation, which is one of the primary symptoms of Chiari malformation of the skeleton is constant chronic headaches. So I just want to make the point about how you think about this, and that's why I'm kind of slowing down here and taking you through the logic of it. Do you, as a practitioner, if you're going to treat this, if you have an interest in this, which I hope you all do if you're watching me and watching this episode, do you want to treat the effects, or do you want to treat the cause? Unfortunately, treating some of the effects is more financially successful to some doctors. But if you can treat the cause, you can save your patients a lot of problem and usually a lot of extra expense. Which brings me into just the thoughts about our current dental and medical systems, and why it's so expensive to go to the doctor nowadays, and why patients are not really happy sometimes with the outcomes. And it all comes back to us as practitioners, us as scientists. We all use to know the scientific method as to how we're going to use that. And if you follow along that science is the study of cause and effect, it would seem that if you treat the cause rather than the effects, you will be much more effective you'll be much more cost effective, and you will actually solve the problem. So, as I said earlier, the cause, inflammation, can and should be studied. I would recommend anyone who's interested in going further in studying TMD, in learning how to treat it, or just understand it, I would recommend that you do a little reading up on inflammation. And I just pulled this up. This is Wikipedia's presentation on inflammation. It's about 30 pages with almost 10 pages of, let me get it up here, 10 pages of references. So you can go really deep into it, but this is just a great simplified description of inflammation. And for example, it is now understood and accepted scientifically that inflammation within the vascular system has a lot to do with acute coronary system, acute coronary problems. And it stands to reason that inflammation has a lot of general effects throughout the body. Inflammation is nothing more than the body's response to any kind of injury, whether it be traumatic, whether it be cellular, bacteria, viruses. Inflammation is nothing more than the body's response associated with its immune response to correct or fix or ameliorate damages within the body. So when the temporomandibular joint is damaged due to the three primary causes of inflammation, which is bruxism, acute trauma, and functional malocclusion, all of them having to do with traumatic injury, either chronic or acute traumatic injury to the joint itself by overuse. It creates inflammation within the joint. Who would argue with that? And that if you decrease inflammation within the joint by unloading the joint long enough to decrease the inflammation, and this allowing the symptoms, which is the effect of inflammation, to decrease, you have solved the problem. All right, so I've taken you through the logic of science and the association of temporomandibular joint pathology to science, cause and effect, and addressing the cause rather than the effects. As always, I appreciate your attention to my meandering, and hopefully it will encourage you to look at TMD in a much different manner and demystify all of the current confusion about this problem, because when you look at it like this, it's really not confusing at all. Actually, it's very simple. If you'd like to learn more about it, you're encouraged to join our group. We have a network of doctors who provide effective service to patients using an intraoral device that unloads the joint along with the protocol that goes along with it. And you can come to our website, www.tmjservices.net, see more about this. And if you'd like to contact or be in communication with me, you can contact me at Tony Urbanek at tmjservices.net. Excuse me, at Tony at tmjservices.net. Our marketing director, Naomi, at Naomi@tmjservices.net. I look forward to the next time we're able to speak. And as always, if you have questions or comments, I appreciate that. I look forward to them, and I look forward to next time I may be able to speak with you.